Let's understand the proper technique for auscultation. So, first of all, ensure the room is quiet, the patient is relaxed, and the area is fully exposed. Never listen through clothing. Warm the diaphragm gently because a cold stethoscope can make the patient tense, which basically alters breath and heart sounds. Hold the chest piece using your index and middle fingers. Avoid gripping it tightly to reduce friction noise. Use the diaphragm for high pitched sounds like breath, bowel sounds, and S1 or S2. Use the bell lightly for S3 and S4 and some murmurs. Press the diaphragm firmly against the skin. For the bell, apply very light pressure. Too much pressure turns it into a diaphragm. Auscultate systematically, like first aortic, then pulmonic, tricuspid, and mitral areas. Compare sounds and listen long enough at each point. Listen to anterior, lateral, and posterior lung fields. Compare both sides at the same level while the patient breathes deeply through the mouth. Place the diaphragm lightly and listen across all quadrants for bowel sounds. Use the bell for vascular bruits. Keep tubing from rubbing against clothes. Avoid tapping the diaphragm and ask the patient to remain still and quiet. Common mistakes include wearing earpieces backward, listening over clothing, using the wrong side, pressing the bell too hard, or auscultating only one area. So basically, auscultation improves with practice. Stay systematic and always listen carefully.